Welcome to the Dental Breakdown Show. This show is where we break down issues in the dental marketplace. My name is Christian White, CEO of White & Associates Practice Consulting, Better Business, Better Dentistry. Let's introduce our guest to the Dental Breakdown Show today, Dr. Todd Hansen. Dr. Todd, thank you for being on the show today.
Well, thanks for having me, Christian. It should be fun.
This is going to be fun, and it's going to be a great time today. Let's start off by having you tell us a little bit about yourself.
I'm Dr. Todd Hansen. I'm the owner and dentist at Lakeside Dental in Duluth, Minnesota. We're located on the east end of town, 5331 East Superior Street in Duluth.
And Duluth is known for its really warm winters, right?
Oh, absolutely. Especially down by the lake. It's a little warmer than, it's a good spot.
All right. So let's ask this question, because I know that there is a story behind this. How in the world did you get involved in this crazy world of dentistry? There's got to be a great story there.
Well, honestly, my mother had been telling me I should be a dentist since I was a little kid, and I never really knew why or whatever. But I guess as I got older, I thought I wanted to be in business for myself, and I thought the healthcare gig would be a good thing. And turns out my mom was right all along. Dentistry's been a really good gig, and being in business for myself and, being able to provide great services and have fun with a great team has turned out to be pretty well. My mom was right.
Moms are always right. My mom is always telling me the same thing, man. So tell me, what do you love most about what you do every day?
That's a good question. I really like being able to show up at my office, and work with a great team of dental professionals, and providing great care for people who need it and want it. And it's really rewarding to see, the team come together and do good things for good people. That's what I really like.
Awesome. That's wonderful. That's actually a really great answer. That's one of the better answers, actually. That's awesome. So tell me something, Dr. Hansen. What separates your dental practice from the other dental practices in town? What makes you guys unique?
Well, I believe that we provide an experience that is different from most dental offices. We pride ourselves in trying to get to know our patients. They're more than just teeth to us, and I know that sounds kind of cliche, but it's actually true.
Mm-hmm.
We realize and believe that there are many levels of dental health that people may wish to achieve. And so we need to figure out, if somebody is not at the level of health that they desire, what level they would like to be at, and help them get there.
Mm-hmm. So would you say that if I was a patient at Lakeside Dental, when I walk in, I'm not the vehicle that's wheeling teeth into the operatory?
That is absolutely true. The other piece that we're learning and confirming and getting people to realize is your mouth is actually attached to the rest of your body. And what we see in your mouth can actually tell us a number of things about your overall health. So it's really, oral health is a huge deal.
So your mouth is pretty much the dirtiest part of your body then.
That is true. Yep.
That's kind of funny, but I think it's actually true. So then when I come to Lakeside Dental DDS as a patient, then I would say that you and your team would it be safe to say you're in the experience business and not the tooth business?
That is for absolute sure. Unless you have a really bad dental experience, I believe that most people can't tell the difference between most dental work that is done. So we need to make people feel like they're special and they're one person there, and we are focusing our attention on them, and then they trust us to do the best dentistry that we can do on them.
Mm-hmm. So Dr. Hansen, how do you build trust with your patients? Because that's a real sacred thing.
It absolutely is. It is the most important thing. And I believe we do it by, listening to the patient intentionally. and like I say, getting to know them and then helping them discover what their situation in their mouth is, and hopefully how it relates to overall health or their overall goals in life, really.
Mm-hmm. And then as far as patients' goals and what they're looking for in their dentistry, how do you find that out, or how do you understand that? I mean,
Well, really, we just ask. I mean, sometimes I just ask, like, if we did some dentistry, what would be different in your life? We don't talk about, the accuracy of our crown margins or the materials we use or anything. We try to talk about non-clinical benefits of what we do and how that would benefit a person non-clinically.
mm-hmm.
And that's a term that I learned from your dad a long time ago, the non-clinical benefits of doing dentistry.
Mm-hmm. Most patients, I think you would agree with this, don't know, like you said, a crown margin, or even what a crown is, or maybe even what an implant is, but they do understand, if you ask them, what are the benefits of doing this and how is this going to benefit me, that they'll have a discussion with you about.
No question about it. That is, if I start talking procedures and stuff, I mean, you can just see them just glaze over and just go, oh man, are you kidding me? Yeah, exactly. So we try to talk about how this would change their real life, not, how close that crown margin is.
So in the process of discovering the non-clinical benefits of the dentistry, Dr. Todd Hansen, how does the rest of the team come in and play into that?
So that is the most important piece of the whole deal. I mean, to be honest with you, if we don't have team buy-in to the practice philosophy or the practice, what we do and how we do it, it doesn't work. So when you come to our office, I believe the minute you walk in the door, you will know that our team is engaged and we're all pulling in the same direction because we believe in what we do.
And your philosophy of dentistry, every dentist has their, philosophy of how they do dentistry. What is yours?
Good question. I believe it's my job to be the best diagnostician that I can possibly be and recognize things that I see in people's mouths and try to engage the patient so that they own their condition and know that there are, possibly some negative consequences coming their way if they do nothing about this condition or not. And hopefully that fosters a discussion of options of what to do about whatever the condition is. And that way the patient buys in and owns it. And it's not me telling the patient what they should do. It's the patient and me and my team co-discovering and co-treatment planning what is right for each individual patient.
So when I'm a patient and I come to Lakeside DDS, I'm not going to have somebody telling me what to do. I'm going to have somebody asking me what to do.
Yes, I make it a point to not deliver a treatment plan to somebody unless they ask for one. And that is a crazy concept in our world. But it's one I learned, again, kind of earlier on from your dad. Jay and I worked together for a long time. And then again, in my education process, I learned how to make that work a little better through SPEAR education.
So, okay, that's great. So let's shift focus a little bit, Dr. Hansen. If you were to step back, and take a look at the dental marketplace right now, what are some of the trends that you're seeing, or what are you seeing, some of the things that are going on that are really affecting it right now?
So I mean, honestly, I think the deal with the large corporate dental practices is probably the biggest news out there. I honestly kind of am in my zone. I don't pay much attention to large macro factors in dentistry, to be totally honest, but that's something that I see in Duluth that's kind of new. And I know it's bigger in bigger cities where the big corporate things are happening. And that makes me a little nervous because I think that dentistry is awfully personal. And I don't know what the experience is like for patients at those places, to be honest, so I can't say much bad. But that's just the feeling I get. If we start losing the personal touch, kind of like, I mean, I hate to say it, but you know, like the medical field, I think is kind of done. That's trouble for dentistry, and it's trouble for patients.
So in the realm of the corporate dental practice, yeah, I think you hit on something that was important. It's the personal touch. Um, you know, I think that going to Lakeside DDS, there's a huge difference between walking in the door there and maybe going to a bigger corporate outfit. I think you would agree with me wholeheartedly on that.
That's what I believe. Like I say, I don't have any experience going, to those offices, but we have had a lot of patients that come in from those offices, and we try to gear our practice towards people that want the personal attention. I mean, if you want to go to an office like that and that's fine with you, I have not one problem with that at all. It's fine for some people, but if you want a more personal experience, then you come and see us.
I don't think I could have said it much better than that. I completely agree. Wonderful. So, all right. So here you are, Dr. Hansen, in the operatory. You're seeing patients all day long. What are the buzzwords, or what are patients interested in, or what are they asking questions about that right now?
Wow, that's a good question. I don't know if there's like a specific thing that keeps coming up day after day. People ask about implants, and a lot of people ask about recession on their teeth, where their gums are receding. They ask why that's happening. A number of people ask about the wear on their teeth. Wear on teeth is a humongous issue in our world. So I get a lot of questions on wear, and I've done a lot of studying on wear and that kind of thing in the last number of years.
Do patients come in and ask about that milling machine that they've seen in other offices, like that you can make crowns in the office? Does that come up?
Yeah, sure. Sometimes they'll ask if we do the same day crown, or
Yep.
We do have a CEREC. We love it. It is changed our practice since we got it. We just have a blast with it, and patients do too. They love to be able to go back and watch the mill sometimes and watch their crown being made, or sometimes it makes noise, and some people put it in a cabinet, and I want it out in the open because I want people to hear it and go, what in the heck is that noise? And it's like, oh, cool, come and check it out. I'll show you what it is. And because a lot of people have had experiences with temporary crowns, and they come off, or they have trouble with them and whatever. It's like, you can do a crown in one day. It's like, absolutely. Here, come and check it out. Yeah, it's really fun.
That's awesome. I have been in numerous dental offices, and I've watched that milling machine and that crown, and that's just amazing, man. I love watching it. I can't believe it's just like, it goes through it, and there it is.
It's astonishing.
It is really astonishing.
I don't know how many of them, but it's still fun every single time. It's so amazing.
Dr. Hansen, would you agree with this, that most patients will choose a dental office not based on technology or gadgets, but they'll base it on the attention that they receive in the office? Am I kind of right on that?
Oh, you're dead right on that, for sure. Like the vast majority of our patients, our new patients, come from existing patients. They talk to our patients and they say, wow, that sounds good. I think I would like to go there. We honestly don't really spend money on much advertising or anything. We really value the referrals we get from our existing patients.
I think that's a testament to you, but it's also a testament to the team that you guys are doing such a wonderful job, that the word of mouth advertising is alive and well. That's a huge benefit for you guys. Well done.
I totally agree. Thank you for saying so. It's a daily effort.
The Dental Breakdown Show, sponsored by White & Associates Practice Consulting, Better Business, Better Dentistry. They are a practice management and consulting firm for dentists and other healthcare-related businesses. Their sole purpose is to implement proven strategies through online and in-practice visits that result in the personal and professional success of the dentist and his or her team.
This is Dr. Todd Hansen, owner of Lakeside Dental Associates in Duluth, Minnesota, where we strive to provide the highest quality dentistry in a friendly and comfortable environment. We've been making an impact on the lives of our patients and our community for over 20 years. If you're looking for a dental practice where the dentist actually listens to you and your needs come first, then contact us.
Dr. Hansen, let's shift the focus a little bit and let's talk about the younger dentists who are coming into the marketplace. You
Sure.
have an unbelievable wealth of knowledge and experience. You're an entrepreneur, you're a business owner. If you could get in front of a bunch of these younger dentists and help them and give them some tips for success, what would be your top 3 or 4?
That is a really good question. Number one, when you get out of dental school, realize that your education is not done. It took me longer than it probably should have, but I finally got myself a real continuing education plan. And that made a world of difference in my professional life and, to be honest, in my real quote unquote life outside of dentistry. There are a number of wonderful institutions around the country. Go to them, go through their curriculum. For me, it was Spear Education. They changed my life. They gave me more confidence, more competence, they help build on each other, competence and confidence.
They do.
And it really solidified my philosophy of dentistry. So continuing education, I believe, is the biggest thing. And it can be scary for young dentists because it can be expensive. But I really wish I would have gone down that path as hard as I did a little earlier in my career. So I think that's number one.
Okay.
Go
ahead.
Number two, I would say would be, this goes for, everyone, but live below your means and pay off your debt as quickly as possible. Get on a plan to get rid of your debt. I see some dentists get caught up in trying to lead a lifestyle that maybe is over their head.
Mm-hmm.
But getting debt free is a huge deal. It really frees you up in all kinds of ways.
Okay. What about in terms of maybe a little more business focus, in terms of understanding your practice, the numbers, and that type of a thing?
Sure. So I have been a dentist who has been hands-on numbers guy from really day one. So we have no training on that whatsoever in dental school.
Nice.
So, having a team on board for that piece is important too, because then you can focus yourself more on the clinical aspect and getting your team on board with your philosophy. So, just to be honest, and I know this is kind of a little biased, but I mean, Jay helped me out a lot with that stuff early on, so that I wasn't really worried about the number stuff, even though I was doing a lot of it. Having somebody, a consultant or somebody behind you on that piece is very, very helpful and gave me a lot of peace of mind.
Mm-hmm. So learning how to read a P&L became exceptionally important.
It's kind of important, yeah. It helps.
The Dental Breakdown Show, sponsored by White & Associates Practice Consulting, Better Business, Better Dentistry. They are a practice management and consulting firm for dentists and other healthcare-related businesses. Their sole purpose is to implement proven strategies through online and in-practice visits that result in the personal and professional success of the dentist and his or her team.
This is Dr. Todd Hansen, owner of Lakeside Dental Associates in Duluth, Minnesota, where we strive to provide the highest quality dentistry in a friendly and comfortable environment. We've been making an impact on the lives of our patients and our community for over 20 years. If you're looking for a dental practice where the dentist actually listens to you and your needs come first, then contact us.
Dr. Hansen, what role has your team played, in your success and in the success of Lakeside Dental?
Well, without the support and the buy-in of the team, I mean, we don't have anything. That's why it's so important. And my team has been critical to the success. I mean, like I said, without them, we don't have the success we do. The patients really respond to when the team buys in, and they know it. They can feel the cohesiveness of what we believe in at the office, and that is the key. And that did not happen by accident. And sometimes you got to find the right team members to make it work.
I don't think you could have said that any better. The cohesiveness of the team is something that I think people can feel when they walk into your office, if you really want to be completely honest.
Absolutely, no question. We get comments on it all the time.
You know this and I know this, but most people come into the office with a Mach 1 crep detector on their belt, and they're looking to see, is everybody going to heaven here, or is everybody going to hell?
Yes, sir.
And the ladies is wound up a little bit tighter than the guys.
Just a tad.
Just a tad. But I think the team, is an extension of your left and your right hand when it comes to your philosophy for your practice. I think you would agree with that.
Wholeheartedly, 100%.
Right, because it's not like that in all offices.
That's what I understand. Yes, we hear that a lot. It's like, how come you guys are having so much fun? It's like, well, we believe in what we do, and we come here and we do it. It's fun.
Well, I think, and also another good chunk that happens to do with the fact that we have a very good leader at the helm too. So I think you should, I'll give you a good pat on the back for that, because you do a great job.
Well, I appreciate that. That is not a natural gift of mine, but and I honestly, I used to kind of think that philosophy stuff was just kind of out there, but
yes.
It's 100% absolute true. If I'm living what I believe and the team believes in it, I mean, you can't lose.
No, you can't. You can only win, and the patients know it. The staff knows it. You know it. Even the dentistry knows it.
Yeah, absolutely. And well, that's the most important piece, is the patient wins too, because we don't distinguish between what's best for the patient and what's best for the practice. They're the same thing.
Yes. Very well said on your part. Dr. Hansen, thank you so much for being a guest on the Dental Breakdown Show today. I really appreciate you taking the time to be here.
Well, thank you for having me, Christian. It was a lot of fun.
So if our listeners who want to know more about you, they want to know more about Lakeside DDS, where can they go to find out more information?
Well, our website is www.lakesidedds, all one word, .com. Our site is actually under construction, a remodel right now, but it should be back up soon, and click on the About Us and you can learn all about what we do.
Wonderful. Thank you for listening today. I'm Christian White, the CEO of White & Associates Practice Consulting, Better Business, Better Dentistry. If you would like more information on today's topic, you can contact us at whitedentalconsulting.com/breakdown. Keep those teeth white, and see you next time on the Dental Breakdown Show.